Round two, it's going to be a quick one. First of all, this is the Medicaid Global Spending Cap Report, April through December of 2019. Could you explain to us in a very tight nutshell why it took 9 months for what is supposed to be a monthly report to be produced?
The intent of the report is to present the proposed solutions to close any structural deficit, and those solutions are reflected in this report consistent with the mid-year.
That's not what I asked. I'm sorry, not what I asked. I said, why did it take 9 months to produce a report which should have been produced on a monthly basis from March to here?
And my answer was that the purpose of the report, we believe, is to present the solution. If a structural deficit is identified, to present a solution. And it was when the solution was identified that the report was produced. Every month's information is contained in the appendix.
That's not an answer to my question, but okay, because you could have put it out on a monthly basis. You're telling us that you basically had no information for 9 months, but at the 9 month, at the 9 month level, then you figured out that you could put together 9 months. That's not an acceptable answer. That's number one. Number two, the governor said that there were no cuts. That's what he said during his budget presentation. And could you tell us what the reduction and consolidation of the rural health funding, the discontinuing of the health workforce retraining program, the discontinuing of diversity in medicine, the discontinuing of workforce studies, and particularly, just as one particular one, the discontinuing of adult cystic fibrosis assistance program, which served 70 individuals, 7-0, and saved the state $380,000. I mention all that to say, how can you make the argument to me that those are not cuts? That's number one. And number two, if we're trying to close a $2.5 billion hole, is it not a little silly to sit here and tell us that we're going to take away something from 70 people that have cystic fibrosis to save $380,000?
So I think, as I mentioned before, it's a challenge in fiscal times, and we're trying to figure out how to move forward and be a little bit more efficient. I hear you about the cystic fibrosis issue and figure out other ways to make sure we're able to provide some of the services for those individuals.
And this is on top of the fact that this is the stuff that is for 2021, right? The stuff that you did, this is stuff that you're proposing for now. And also we talked about earlier about the fees for children's camp permit fee, asbestos safety program certificate of need fees, which give us $680,000, $70 million. It just seems to me like this is all pittance in the big scheme of things, and that we should be looking elsewhere, particularly on taxing the wealthy, but we're gonna have a whole conversation about that another time. For you folks, I got two more. First, as it relates to both of these things, so if you are asking us to say that there were a bunch of people that brought up, there was the Maximus contracts that were brought up, the fact that there was a very clear statement that said that there were no cuts then when there obviously are, the MRT conversation that we've had over and over again, which says you provide no details about anything, and then you also, as it relates to this, when we're trying to figure out how it is driving the cost, right, I will admit to you that I am not as smart as many of the folks that we have in our central staff. And our central staff has been talking to your central staff and asking very specific, pointed questions so we can have a better understanding of what exactly is driving costs. Tell us where it is, right? And the exact information, you seem to have the numbers, but you can't tell us where they come from. And they're asking you better questions than ever I could, and you're not giving it to them. So, all of this is what I want to get to, and I want to make sure this is very, very clear. Whether it's on the MRT, whether it's on the Maximus contract, whether it's on the suggestion that there are no cuts when there obviously are, what you're asking us to do as a legislature is to trust you. Folks, this don't build trust. I will only speak for myself in this moment, but I figure many of my colleagues can agree. We don't trust you. You gotta build that. This ain't helping. And the last thing that I'll say in the last 50 seconds is one other thing that just, as if we didn't have enough stuff to deal with, and this is something that's bigger, the public charge rule that was just implemented, right? The Supreme Court decision just a couple of days ago. It was literally a day ago. We really got to get into that. We really got to get into that because that could have a potential impact of $7 billion, according to some analyses. And if we're already in this mess and you're not being honest with us, we got to fix this together. You got to build trust to do that. This don't do it. The hours that we spent here does not do it. And you know I like you folks. But I'm not going to sit here and not say that all this fighting that we're doing is because we know the impact that it has in our communities back home. We got to fix this together. We got to do it by building trust. We don't trust you. You got to make us trust you. This did not help. Thank you, Madam Chairwoman.